Of the week. We're joined by our resident medical expert, board certified ER Dr. Michael Daignault. Thank you so much. So sorry to hear about the boss and his condition. He is about to turn 74 years old later this month. What is this peptic ulcer disease? What causes it? Treatments, etc.
So, Marlo, one of the number one reason people go to the ER in this country is for abdominal pain, and peptic ulcer disease is something that we always keep in mind. So the stomach has a very thick lining because it's meant to be acidic. And so over time, if that lining gets worn down by alcohol abuse, use of common over-the-counter pain medications like ibuprofen, naproxen, aspirin, that lining can be worn out. And it can develop holes called an ulceration or perforation, or you can end up with upper or lower GI bleeding. And so we don't know if he had any complications, but this is very common. It's usually diagnosed with endoscopy. It's treatable for most people within 4 to 6 weeks with medications called proton pump inhibitors, which turn off the acid-producing pumps in the stomach and give that lining a chance to heal. So hopefully we'll see the boss back at it soon enough.
Okay, so hence why he's just canceling the September shows, and hopefully that's it, and he'll be back out there on stage. Okay, good to know. Let's talk now COVID. The World Health Organization is calling for increased vaccinations and surveillance as it warns of what it calls concerning trends ahead of the winter. They're really focused on the new variant of concern is BA.2.86. We've talked a little bit about this. Why is that of concern, Dr. D? And what do we know in terms of the new booster shot that is going to be released? Does it protect against this?
So there's some good news. I had a chance to review data from 3 separate labs and talk to some of the scientists and the virologists over the weekend about this data because we were very concerned about BA.2.86 because of its multiple mutations, as you mentioned. So the good news is it appears that the virus BA.2.86 is not very efficient at getting into our cells. Number one, which is good news. And number two, it doesn't appear to evade our immunity, our existing antibodies, more so than previous variants. And then most importantly, they looked at blood samples of people that have had the XBB variant, and it showed that their antibodies were still able to neutralize BA.2.86. So that's very good news because the new vaccine includes the XBB variant. So I was very relieved by these 4 separate studies from different places around the world, and it portends well for the new vaccine booster.
Okay, and we're going to know more about who is eligible a little bit later this month.
Next week, they have the meeting, and we'll be on right after that to discuss. So.
Okay, very good. Now on to this, an alarming new report. It shows cancer rates among people aged 50 and under. They've skyrocketed almost 80% over just the last 30 years. This is led by breast, prostate, and lung cancers. Researchers tying the rise in part to a Western diet, how we eat here in this country. What's behind this rise?
So I think there's 2 things. As you mentioned, diet, sedentary lifestyle, obesity, not exercising, things like that. But then also this study took place in the UK. The results were published in the British Medical Journal. And it looked at patients over a long period of time. And in Britain, they're doing more extensive testing, right? So a lot of the increase could be attributed to more aggressive testing, following the guidelines when you need to get certain tests to rule out cancers. And so interesting, look, their data has shown that although the rate of increase of diagnoses has increased, the mortality has decreased. And that's because they're catching more of these cancers at an early age.
That's good. Okay, yeah. And then the other study, and we're out of time, is bottom line, if you exercise, you reduce your risk of so many cancers.
You said it. Yep, that was a great study to see that.
Got my run in today,
That's right.
Doctor.